Hi, I'm Dr. Margreet Barnard, your host of the Birth and Baby Show, brought to you by Birth and Baby and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Lily & Terry International. Discover a gentle, holistic approach to motherhood with Lily & Terry International's range of mom and baby wellness products. Thoughtfully formulated with natural essential oils and supportive homeopathic blends, each product is designed to nurture both body and mind through every stage of the journey. From the calming, relaxing for moms and tots bath oil, perfect for shared moments of relaxation, to Pregni, which supports comfort and skincare during pregnancy, this range puts moms first. Little ones are equally cared for with solutions like Aptocalm K for digestive comfort and Lullaby for restful sleep. The Stretch Marks formula helps improve skin elasticity, supporting confidence as your body changes. Gentle, safe, and effective, these products transforms everyday routines into meaningful moments of care, connection, and well-being for both mom and child. Hi everyone, welcome to a brand new episode. I'm so excited that we are having a mother in the studio. It's time that we talk about some real birth stories again, because that is the most educational and inspirational. So for today I have Gabriella with me, and she's a mom of 3, but yet the one still need to come out. So she's highly pregnant. She had 2 previous births that she's going to tell us all about. So Gabriella, welcome to the show.
Thank you. It's such a privilege.
Yeah.
I'm really grateful.
Yeah, you've got a lot to share that is super valuable for our listeners. So thank you. Tell us a bit more about yourself.
Oh, yes, that will be quick. But so I'm a mother of 2 girls. Our boy is next. My husband and I have a neuro football club, and I'm now a new author of a children's book. I'm this very passionate subject of mine is birth and pregnancy. It's something that I love this subject. So thank you so much for having me on.
Yeah, you're the right mother to talk about birth.
Thank you. Yes. Yeah. So I'd like to jump straight in there.
Go for it.
So something along the journey happened with the first birth and the second birth being so different. So with my first birth, my first pregnancy, I was always more of a natural person. I always wanted to go the natural route. But we don't really have like a society and a culture in South Africa that pushes that or that promotes it. It's very much a medically driven route. And as a person, I'm really submissive, I would say, and a bit of a people pleaser. So it's a really bad combination, I would say, to have when you're with a medical team, because if you don't know what you want and you're quite submissive in that situation, it can take you down a route that you didn't plan. You could kind of go with the flow of the medical team instead of going with what you truly wanted. And so I would say that combination, and I feel like that's for a lot of women. They're maybe a bit more people-pleasing and quite submissive. And so, you don't want to kind of come in there and demand to a medical person who knows so much more than you what you want. But the problem is that I've found out over the years with medical people, they're not horrible people that want to do you wrong. They have so much, they went into the medical industry because they carers, they have so much to give and so much love to give, but they're also managed by a hospital protocol or by their insurance. And so they have to follow all these rules and regulations, and that subsequently makes them make decisions that are not always conducive to the woman and the child. So the baby and the mother might have to be under their insurance policy, and what that, it can get them so far. And so basically I discovered quite quickly how being submissive, being a people pleaser, and being within a system that is not always going to look out for the mother and the child, the mother and the baby, it can quickly slip.
So true.
And so that, and what the worst part of that, I just call it a toxic cycle, because then the mother submits to a law, really, or a policy or a protocol, or whatever it is, so that the lovely medical personnel that you're dealing with doesn't have to go through a lawsuit. So they're trying to avoid that. And then that can really harm a mother and a baby. But not just for the pregnancy and the birth, for years to come. And then we become more reliant on the medical system, because we've been dealt with in such a way that now we have baggage of medical issues. Could it be pelvic floor or adhesions from a caesarean, or bladder issues from a caesarean, all these things. And so you become more reliant on the medical industry. And so it's just this toxic cycle. Wow. And so I'm so passionate about telling women, really, you have so much authority over your body, and you have so much responsibility to research, because their responsibility is to keep themselves out of jail or a terrible fine, and to keep them, not being deregistered. But our responsibility as mothers is to keep us healthy and our babies healthy. It's not to follow the medical industry just willy-nilly like a sheep, following whatever and thinking that they want the best for you, because they are constricted within their bounds. Yeah. And so basically that's my first story. I had an antenatal course with my husband, and we were so excited, and it wasn't the best course ever. I think I would have loved them to talk more about the physiology of a mother's body and how beautifully made we are. And I probably would have had more confidence in natural birth maybe, but what they did do, which was great, was they spoke about the serious risks of caesarean and just how it is major abdominal surgery, and that you can't really be like, cool, I'm going to plan a major abdominal surgery because I want my baby to come out on this day, or I'm going to do it because I'm really scared of natural birth. Like those two reasons, one being maybe a positive reason, the other one being really fear-based. It's just like anything fear-based, any decision we make in life that's fear-based is not going to lead to a fruitful result. Even if it's like, cool, I didn't have to go through the pain of natural birth, and I'll maybe speak about the pain of natural birth in my second, as I'm a VBAC, but it's a really sad reason because of the risks. It's not a good enough reason to kind of submit to, I think it's going to be a safer thing to put my birth into a medical professional's hands by going with a caesarean, because it's just less risky. It's just a lie.
It is.
It's a really bad lie.
Yeah.
I mean, I'm not.
Sure. No, you've got so much understanding of the... You've dived deep into it.
Oh, I've dived deep.
This is the most beautiful summary I've heard of actually what is really going on. And
Sure.
And it is the truth.
It is.
I know it from the professional side.
That's
so much.
it.
Yeah. So
from
it's
the experience.
So good to hear it from your experience, because what you explained, it's the truth.
And it's so sad that it's being perpetuated as the truth. And that's I think why I get so riled up about it is because I think when something is told so often to you, or you're living in a society where it's so common, the lie becomes the truth, or the truth. And it's so very sad because of, I don't know one other friend of mine who's had a VBAC, but I know a handful of friends who've had caesareans, and I know two very close friends who've had natural births, and they were wonderful. But what's deeply sad is that it's not a thing that women can easily talk about in this country, because all of a sudden is, oh, you're so judgmental that I've had a caesarean, or you're so judgmental or alternative or whatever it is, and it's sad because you shut down quite quickly.
True.
But it's so much more than that. It's all the reasons behind it, I mean, you could go for an hour talking about the benefits of natural birth and the risks of caesarean. And I think this is Caesarean Awareness Month.
That's right.
So yes, the awareness should be it's major abdominal surgery that has great risks.
What happened?
What happened
for you?
So we had the antenatal course. I went in with a beautiful birth plan, and I was like, we found out the detrimental effects of epidurals and any other kind of intervention like Pitocin or whatever, Pitocin, I don't know how to say it. So we were like, cool, we're all natural. My husband and I were like, we're going in natural. And so, of course, and I was mentioning earlier, like friends always ask, okay, could you tell me about the most pro-natural gynae? And that was my question. Like, I didn't even know that you could go with a midwife. It's like, okay, I need to find the most pro-natural gynae.
Right.
And so I was told about one, and towards the end, despite, knowing all my wishes and the whole birth plan, towards the end, things just started getting a bit more skewed and more controlled. And I think just to mention some of the things, for example, the one morning I woke up, I think I was close to 40 weeks, and I said to Sean, oh my goodness, like the Lord is saying, do not have the cervical check today. You need to just have the scan, that's it. If you want to have a scan, have that. But I feel like the Lord's saying, don't have the cervical check. So we go in there, and we mention this to the gynae, and the gynae asks, like, why? Why not, And so I was like, I just don't feel like it's the right thing to do at the moment. And there was a bit more questions about it. And in the end, I was like, I think it's also because I don't want to introduce any infection. And just like my mindset around it, I don't want to be disappointed if I'm not dilated or anything. And in the end, the gynae convinced me, and this is my fault, you have authority to just be like, no. But I was convinced in the end to have the cervical check. And so interesting, from that point on, I did get an infection, and actually at the end of it, my placenta was so infected, it apparently had blisters and things on it. And so it was the most infected placenta apparently that the laboratory had seen. And of course, I asked the gynae after, but I was like, is it something I ate? Like, can you imagine? I was so uneducated about it. She's like, no, it's the other way. Like, you would have it from the other way. And so obviously, it's just those things where you have a gut feeling, or the Lord speaks to you and you should stick with it. So that was the first thing. And then there were multiple interventions, you could call them. From that point on, where I hit 40 weeks and the gynae said, look, now the stillborn rate goes up significantly. We're going to have to induce you. I was like, whoa, what? We don't want that, This is our first birth. This is really serious. Don't want a stillborn. And had I just gone home and done the research, I would have found out, I might be wrong, it's a few years back now, I think it's like 0.1 to 0.2% increase in stillborn after 40 weeks. I was like, sure, if I knew that was the percentage, I would have never gone for an induction. But I've also recently learned that your amygdala, the risk assessment center of your brain, is really heightened at the last few weeks of pregnancy and definitely during birth and labor. And that's because I can't see my feet when I'm standing. My sense of gravity's off. I know I can't sprint. So obviously my body's making me feel a bit more vulnerable, so I'm more cautious. And so you are more cautious in those last weeks. And I think they take advantage of that, to be honest, so that they're more covered and they're not having to be sued. And so, if things don't go the way they want and stuff. And so that was really disappointing to find out in hindsight. And that's why I'm just like, take the responsibility. You've got to do the research. You can't submit to medical personnel.
Unfortunately not.
Yeah, unfortunately not. And that's the thing, right? You're just like, they know more than me. They know more than me and they want the best for me. But like I talked about the toxic cycle, it's not that they're evil and want the worst, it's that they have things to follow. So anyways, I was induced, and that was just a mess from like the start to the finish. Because I was told to sit on the bed in the hospital. I couldn't move. My body was so wanting to move, but I had to be monitored the whole time. And then eventually they were like, no more sitting with the strap. You have to lie down. It was like a torture chamber, to be honest, not to scare women off. But I really hated it. There was a shift change of nurses that was strange. It was like a 12-hour labor and there were several shift changes. And the nurses were a bit funny, and like Sean kept on having to close the curtains because he was like, let's just have some dark, quiet, private time, Out of his instinct, we didn't realize that's perfect for physiological birth. But the nurses were just like, barge in, and then the next one would come in. I was just like, whoa, this is intense. Like, there's no chance for me to just get into labor.
Surrender, yeah.
Surrender. That is natural birth, right? Anyways, so in the end, I'd put on the birth plan, don't offer me epidural. I knew that could be something that I was like, okay, hit me up, while you're in labor. But there was several offers. And on the last one, I said, no, thank you. I'm really fine. And she said, you don't have to be a hero. And at that point, I was so like, oh, I don't want to be that like pushy person who's just trying so hard and not getting away. Maybe it's going to help me dilate. I'm going to get the epidural. And that's something maybe that ladies can take away is drill your husband to be like, no matter if I'm screaming at you and like saying, give me the epidural, he's allowed to say no. Like if you don't want one, he must be like, no, she does not want one. Anyways, I had it worked down on my, I think left or right side, the other side didn't work. And then I wasn't dilating any further. I apparently stalled. Found out later that birth is non-linear. It's not meant to be this like perfect 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, dilation where there's no pauses in between. It can pause. And an epidural would definitely pause it. But anyways, in the end, I was just like, cut me open. I'm done. Like, I'm so disappointed. And you know what's so funny is on my form, it said emergency caesarean. And I was like, but I asked for it. It wasn't an emergency. Like, there was no emergency about it. I was just like, I'm done. I was so disappointed, so like pushed about that in that state, I gave in. And so that's the first story.
Wow.
Okay, and so the second story is very exciting and very wonderful, in that I had now got to a point where I was really dealing with the Lord on just all my stuff of like being submissive but not really taking responsibility for my side, and not people pleasing in fear of man, fear of people. That was a huge part. And so that was the first part. And it's so interesting because I had zero fear of natural birth, but there was other fears to deal with. And I think that's something for women to really take on as like the most important part, I think, is to deal with your own fears. To go into birth not with baggage of, oh, I'm afraid of this happening or afraid of that. Take it to the Lord and then speak to people. Because actually the research is so wonderful. Yeah. It's so wonderful. The way that we made and the way our bodies birth children is so incredibly beautiful. We don't need one other person to be able to do it, right? And so the physiology of our body, it's like it's breathing, it's eating. We don't tell our heart when to beat, and it's the same with birth. And this is what I discovered. I discovered that... actually only recently, that's more for the third. Let me tell you what happened in the second. So in the second, I read a book that was just basically dealing with my fears and with my baggage and dealing with how I can be polite and like you would say Christian-like, but not pig-headed, but stand firm.
Yes.
You can say no to something as many times as you want and not be pushed into something that you don't want to do. And so my husband and I found out that we could go the midwife route, and we did. And I spoke to a few midwives and just asked them lots of questions about VBACs and how many they had done, and asked them what their insurance policies allowed.
So VBAC, not everyone knows what it is.
Yes. It's vaginal birth after caesarean. Yes. And so that was the journey, and it was wonderful finding out some of the answers. Some medical professionals just couldn't because of their insurance. They came up straight up like, I can't, it won't cover me. Or I can, but you can only go to 40 weeks and your baby can't be over 4 kilograms, and I can, but you're only allowed this amount of time. And so I really had to gauge what their insurance policies and what the hospital said. Not, sometimes there were wonderful women, wonderful medical professionals, but it's just that they were too much in the system that they couldn't. And so that's what I had to really look for. And finally, I found a wonderful midwife. I was like, Sean, that's my husband. I was like, we're going to get a doula. We're going to get a midwife. We're going to get every single person in the room that we can that's pro-natural. And I had a wonderful friend of mine also pray. She was interceding the whole time in the room. She's a wonderful intercessor and a mother of 4, also gave birth naturally. And I thought, just like her presence is very alternative, I was like, she's going to help me be like, no. Because you don't want to go into birth thinking that you're going into battle.
No.
You want to surrender
and
be peaceful.
Yes.
And that's a feminine energy. It's not like masculine,
no,
you know?
Absolutely.
And even if you want a hospital birth, just remember that you might have to be in the masculine energy of battle. And that's not how you want to enter a natural birth. You want to be surrendered and peaceful and supported. And I heard something, wait, let me tell you about the second birth, and then I'll just tell you about the third quickly. So not that it's happened yet, how I've prepped. So with the second, the only thing that I had real faith battle with was, Lord, will I go into labor naturally without being induced, because you can't be with a VBAC, before this doctor says so, this midwife, says so, because she wasn't allowed to go to 41 weeks and 3 days. That's the best I could find. And so I was like, cool. Lord, you're going to have to make this baby come before 41 weeks and 3 days.
Right.
And so that was my biggest faith battle, because my whole focus was, I just want to go into labor. I just want to be in labor, and I want to do it without anybody intervening. And so the Friday before my 40 weeks, I was a few days before 40 weeks, I go in to see my midwife, and I was just sitting in the car, and I was like, Lord, do I even have the cervical check? She might ask for one. Like, I don't want to go wrong this time. And I felt such peace in saying, do what you want. You can have one or not have one. This time, you choose. And that's the beautiful relationship part, and just like knowing in your gut, knowing your instinct. If you're not a Christian, following your gut, because that's so important.
Yes.
It's not the same every time. You can't tick off the. And so, this time it was like, do what you want. And so I went in, and I was going to only do it if she asked. And she was like, may I? Can we check? And I was like, yeah, sure. And I was 3 centimeters already. And so that was the best news.
Wow.
That was like my years. It was so exciting. All the 9 months, I was so excited.
Aww.
And so I was 3 centimeters, but what was so great, she was like, cool, I'll see you when you're ready and go into labor. And I was like, but I'm 3 centimeters. Before, that was apparently in the medical room, like, you're in a hospital, you're going to have to start laboring with us because your contractions are so strong. But she was like, I'll see you when I see you. That was amazing to me. I could now go home with peace and just continue the process. And so that continued until Monday. And I was having contractions every day. They would start just a bit earlier each day. And then every time I would go to sleep, they would stop. And so on the day that I actually went into labor, they started at 2 p.m. instead of at like 4 p.m. And they didn't stop when I lay down. And so I was like, I'm in labor. I was so excited.
Amazing.
Sean was so cock-a-hoop as well. We were just thrilled. And I was welcoming the contractions.
Aww.
I was like, oh my goodness, this is the most exciting feeling. And so because of that, I'm convinced they didn't hurt. They were really intense. They were really powerful, but I cannot call them pain. I was so over the moon when they were happening, because that was my battle won. I had gone into labor, that I was excited for the next contraction.
Wow.
And the stronger they got, the more excited I got. So I was doing like squats and trying to keep them going more. And like if I lay down and they quietened, I would be like, get up, let's go. I was so loving it.
Amazing.
Loving life. And then I reached around midnight. And I went to the bathroom. And then I also started bleeding a bit. And I was like, oh, this is really intense now, love. Maybe we're okay to get to the birthing clinic. Because we were also very mindful that there's a time on a VBAC. And so we didn't want to get there early.
Right.
And so we were like trying to hold off as much as possible. And then I said to Sean, like, I think we should go now. So we go, and already what's so fascinating is getting into a car as an intervention. Your body knows now it's in a different environment.
Yes.
So my contractions slowed. And then we drove to the birthing clinic. We got there. I was so fine. I was like, love, I'm so sorry. I think we may have come too early. They've really slowed. Like, they were actually so manageable. I was carrying the bags with him. And then we get into the room, and I'm like chatting to him. I'm like, okay, we'll just wait for my midwife to arrive and everything. I was totally totally compos mentis, totally not in pain. There was like gentle contractions, gentle. And also what was so interesting is they couldn't be timed. I tried to time them, and some were 15 minutes apart, some were 2 minutes apart, some were 5 minutes. There was no linear pattern the whole way through. And so I stopped measuring them, and I was just like, I have no idea, but they just feel like I should go, okay? So then we get there, and I'm lying on the bed, and then my midwife is like, can I check you to see where you're at when she arrives? And she's like, Gabriella, you're at 7 centimeters. I was like, what? Then I was like, okay, I can sign the forms, and I still danced and worshipped, and my husband and I chatted, and I was just like, this is wild. Like, I would just breathe through the contractions when they would come, but I was so elated when they restarted again. And I was so excited that I was in labor that there was no fear around birth.
No hold back, yes.
There was no hold back. There was no... and also when I walked into the birthing clinic, it smelled of essential oils. It didn't smell of a clinic.
Wow.
And that was, it was just like something I really remember. I was just like, oh, it smells so good. And then... the room is like a hotel room. It's not like a hospital. Everything around it was dim. Everything around the surrounding, in hindsight, I was like, wow, that's really great for a physiological birth. So then the only part I would say that was painful, and now I know in hindsight as well why it was when I got to 10 centimeters, I was told to push, but I had zero urge to. There was no urge to push at that point. And I know... I love my midwife who's not with us anymore. I mean, in the country, gosh, that sounds terrible. But her intention is not to like, quickly, let's get this over and done with. That was not her intention. I think she was very mindful of the fact that she knew how many hours we had been at the clinic.
Okay.
And there was a second midwife there who was very strict.
Okay.
As soon as we walked in, there was a lot of things. And so I think she was just like, okay, if we're going to carry on with this without going over the time, we're going to have to get this going. In hindsight, I think that's what happened. But yeah, I was coached to push at that point with zero urge. And I basically had to use my pelvic floor. And the worst part about it was Mila was facing posterior. And so I had a posterior situation with pushing. And so my back was really sore, but I kind of just carried on. It was surprisingly not terrible, like 4 hours of pushing. It was like 1 hour 45 too. It's still way too long, still not necessary at all. But there came a point, like a couple of minutes before she came, I was just like, my back is splitting apart.
Yeah.
Like, this is not right. The contractions were not painful. My back was in such pain.
But that's from the posterior position.
Posterior position, exactly. Yeah. And so they were like, oh, it's your back that's sore. So they tried to get me in positions because they realized that she was posterior facing. And the only thing that I think really got her out was I heard my midwife say to the second midwife, or the other way around, we might need to look at a transferal or something. We might need to look at her having a cesarean. And I was like, what? I like paused.
Yes.
Say again? I was like, no. And then I really pushed, and she came out totally facing up, totally posterior facing. So... But was like the ring of fire, don't fear the ring of fire. Do you know, my back was so sore, the ring of fire was a relief. I was like, oh, this is so wonderful. She's coming out. Like the contractions were a relief because they were actually towards the end, there was finally an urge to push. And so that was the second birth. And so when I look at it, I'm just like, that was incredible. It was not painful. It was so full of love and gentleness and peace, except for the pushing. And so for the third birth, my whole focus at the moment has been studying a physiological birth. Is that what it's called?
Yes.
Okay. So I'm now studying what is a pause, that physiological pause. When it comes to you, 10 centimeters doesn't mean you have to push, right? You can wait up to, some women I think go for hours at 10 centimeters, apparently, before they start having an urge to push. And what I've learned now is that your uterus is the most incredible muscle that gets really hard at the top. And when that gets really hard at the top, that helps to push the baby out. It like lengthens, apparently gets hard and then pushes the baby out. And your pelvic floor is not meant to be involved. It's like, cool, get out the way. You're out the way now. Cool. Now we can push with the uterus. And the reason why I think there's so many women who have pelvic floor issues post-birth is because their pelvic floor is getting involved in the pushing phase, and it shouldn't be, right? And so we're being coached like, hold your breath, push, and that's really probably very beneficial if the woman has the urge to, if there is the incredible power of your uterus working with you. And so that's my focus for this next birth, is to just be at a point where I actually feel like I should be pushing. And that, as far as I understand, helps the baby rotate and descend to weight. Whereas if you start getting involved with the pushing, you actually you're depleting your baby of oxygen sometimes. And Mila did need some oxygen after birth, nothing major, but she did need some. And I was just thinking, like, if you're in a situation where you are allowing the women, and this is the one of the things I wanted to say, I've rambled on for a very long time, but a mammal, I've been looking at, like, when you see mammals give birth, they have dark, they have privacy, they're not watched, they don't feel threatened. And as soon as any of those things are introduced, they stop.
Exactly.
Their labor stops.
Yes.
And so we're the same.
Yes.
We have to have dark, privacy, quietness, nobody watching, so that we can give birth naturally without the damage. And it's because hormones switch on and things switch on at the right time with the right, oxytocin.
Versus adrenaline.
Exactly.
Yes.
Just very much attached to all these things. And so what I would say to a woman who's preparing, and to the husband who's preparing with her, is to not to shy away from researching the physiological birth.
Exactly.
Because that has such power. It is the best way to birth with the least risks involved. Even as a VBAC, the most risky thing I can do now is have another cesarean. There's more risks to me having a cesarean than being a VBAC and having a natural birth. The greatest risk, as far as I understand, is having an emergency cesarean. And the only reason why I would lead to one, because it's something like 1 in 1,000 need it, is if you are going to interrupt the process so much that your body starts closing up, much like my first labor. If you're intervening, you're not going to have the experience where your hormones and everything is switching on at the right time.
Exactly. Yeah.
And so that's the plan for the third.
Oh, wow. You're just building. You were so knowledgeable because you had every experience. Like, you had an induction, you had an epidural, you had a Caesar, then you had the occiput posterior position, but a natural birth. So you're a very good case to learn from. But just to encourage everyone actually out there. So over-medicalization of birth has become a real issue, and we're fighting it on all levels. So to the extent that WHO, World Health Organization, has put new guidelines out there to give us more time. So now in South Africa, for example, we have changed our own maternal guidelines, and you will love this. In the guidelines it says, when a woman is fully dilated, wait for the urge to bear down. So now we're not so stuck with the strict rules anymore. We've been given more time.
Awesome.
So all of that to just not intervene too soon. So that's encouraging, and that's also for healthcare professionals nice to know. Like, okay, we won't be sued because of this and this, because our guidelines says this and this.
Wow.
So that is where you started from, how we sometimes are so restricted to our guidelines, because if the pawpaw hits the fan, in court they will look at your guidelines. But now our guidelines allow way more for nature to do its thing. So we are moving back to where it should be.
That's wonderful.
It's good to know.
That's so good to know. I'll be like WHO.
Yes, and our South African maternal guidelines always align with that. So they've changed and updated. Same as the time from when you start really going into active labor, when you want to measure those centimeters, as you said. It used to be 4 centimeters, now it's 5 centimeters.
Wow.
Just to let women labor at home as long as possible, as you did. So we just all need to get with it. You know? And for women to know this information is so powerful. So thank you for sharing that.
Thank you.
We're going to use this episode as an extra resource to empower our women, right? And this is what I'm teaching midwives left, right, and center to understand physiology better, the hormonal dance, the importance of. Yeah, we see that often. A woman presents at a maternity unit and we look at her as like, you're not in labor. Meanwhile, at home, she's been in labor much, but now she's obviously fearful.
That's it.
Adrenaline comes up, oxytocin hides, it's a shy hormone. And we just need to calm her down and make her feel at ease, and the contractions will come back.
Amazing.
We need to know nature.
We really have to.
Yes. Thank you so much, Gabriella.
Thank you, Thank you for having me.
And may the next birth be the best.
Thank you.
Yes, may it be an absolute blessing and the cherry on top.
Yes.
Thank you. So I hope you enjoyed this powerful episode. I know this is what the world needs to hear. Thank you so much for listening. See you next time.
If you enjoyed this episode, please share it with a friend who would benefit. And remember to subscribe so you never miss a new release. If you're watching on YouTube, hit that bell icon for notifications. And if you're listening on your favorite podcast app, please leave us a rating or review. It truly helps us reach more people. We'd love to stay in touch and keep you equipped with our latest resources. Midwives and birth workers, head over to sensitiveMidwifery.co.za/free gift for your special resource. For moms, visit birthandbaby.co.za/free gift for more training and support. You can find both of these links in the show notes or description below. Thank you for being part of this community. And remember, you are making a big difference because you are shaping the future of humankind. Thanks for joining us, and I look forward to journeying with you.